Good day, colleagues. My name is Campbell Paul. I'm an infant psychiatrist and I work and live here in Melbourne, Australia. I'm on the lands of the Wurundjeri people of the Kulin Nation, who've cared for this area, this nation, for some 60,000 years of continuous culture. And I acknowledge elders past, present and continuing, our colleagues who are caring for this environment, and also acknowledge people with lived experience of mental ill health and those that are caring for people with mental ill health, including infants, children and adolescents. And that's the point of this reminder today, that we have celebration of the needs and the work that is done to support infants, children and adolescents with major mental health problems. We know that infants and children and adolescents can suffer from depression, from anxiety, from a range of major mental health difficulties, and that this is an increasing phenomenon. The focus of the honouring of the mental health needs of infants, children and adolescents this year is upon the needs of children who are displaced, and displaced by hostilities, by war, also by natural disasters such as earthquake, flood, fire and other disasters. The symposium that will be available on the 29th of April is put on by 4 associations. It's a collaboration of the International Association for Child and Adolescent Psychiatry and Allied Professions, IACAPAP, the International Society for Adolescent Psychiatry and Psychology, ISAP, the World Association for Infant Mental Health, and I'm the past president of the World Association for Infant Mental Health, and have a real pleasure in participating in the symposium that's going to be available to you. The 4th key organisation is the World Psychiatric Association Child and Adolescent section. So this is the 4th year that we've celebrated World Infant, Child and Adolescent Mental Health Day. Previously, we've had seminars with distinguished speakers on various themes. And this year, we're adopting a hybrid format. A number of us are going to be meeting alongside colleagues at the Turkish Association of Child and Adolescent Psychiatry, their annual national conference, which is the 34th National Congress of Child and Adolescent Mental Health and Illnesses, which will be in Kasudasi in Turkey at the Pine Bay Holiday Resort. And that's going to run from the 29th of April to the 3rd of May. So a number of us will be there in person at a symposium, but this symposium will also be available online through our respective organisations and through direct contact on Zoom. And at the end of the presentation, there'll be some instructions on how to connect. So, as I was saying, I'm very much involved in infant mental health and have had the honour of working with dedicated, creative and committed colleagues from the World Association. The World Association, we have some 70 or so affiliates in nations all around the world, and are very proud of the work that our colleagues do in meeting with infants and families, children in the infancy and preschool years, and the people who are working with them and caring. We've run a number of World Congresses since 1980, every 2 years, essentially. We had one during COVID, which was hybrid and was delivered from Brisbane. Recently, we had Congress in Dublin and then in Tampere in Finland. So our next World Congress will be in Toronto in October next year, 2026. So just to leave you with encouragement in the work that you do in working with infants, their parents, older children, adolescents and their parents and their families and their colleagues and their teachers. I'm really honoured to be part of international organisations who are doing amazing work on the ground with children, and how important it is to intervene, to support, to work with, to understand the problems that children in their developing years can experience. So I look forward to seeing you in person one day, perhaps, and thank you very much for participating and listening to our brief presentation. I look forward to seeing you in the conference. Au revoir, and keep well.